Dr. Duvilaire, thank you so much for being here today and taking some time to answer a few questions related to COVID-19, as we know has impacted our nation, has impacted our local communities. Can you please tell me how I can help protect my household from COVID-19 so that I can ensure that, my family stays safe?
Good afternoon, Councilwoman Nirva LaFortune. It is a pleasure to be here and as well to answer some of these concerns. As you know, COVID-19 has been with us for a few months now. The way really for us to protect ourselves, our family, is by wearing a mask, washing our hands, and keeping that 6 feet distance with when you are not with your members of your household. These are really the gold standard steps that we know. And of course now we know that there is a vaccine. With the hope that it will help to lessen effects of this pandemic.
Yeah. Like many people, I am so eager to get back to my normal life, spending time with my friends, my family, actually going into the office to work. When do you think we'll get back to doing these things?
Very good question. Like many of us, I'm tired of really wearing a mask. But what we do know is right now what we can do is wearing the mask, washing our hands, keeping that distance that I talked about, the 6 feet distance, and also looking forward to the vaccine being efficient at reducing effects of the virus on our body.
That's right. So I've been speaking to people throughout the community and have been hearing their voices and some of their concerns. We know that there are significant disparities in healthcare amongst communities of colors, and there are concerns about the efficacy as well as safety of the COVID-19 vaccine. So I want to ask you, as a healthcare provider practitioner, is the vaccine safe?
Really good questions, because we know from a historical perspective what communities of color have undergone. But what I can say is with the Center for Disease Control and Prevention, as well as the FDA, they have really vetted the vaccines that we currently have. They are in terms of their testing, their review, and their safety protocol. As well as in Rhode Island, we have medical leaders and community leaders that have reviewed the safety protocols of the vaccines, so that these vaccines now are able to be available for distribution.
So I want to get back to the normal way of doing things, but I still have some concerns with the vaccine, but I also want to make sure that I'm keeping myself, my household, my community safe. So can you tell me, once it is available, the COVID-19 vaccine is available to me, will it be safe to take?
Vaccines in general are safe to take based on the disease that it's and the research that it has undergone. For this vaccine, the COVID-19 vaccine, there is a fear that it was developed very quickly. But even in the quick turnaround that we had it still had to go through the same rigorous safety protocols that are necessary for vaccines to be approved. So in that sense, I am confident that right now, with the vaccines that we have, it is safe because they had to be reviewed.
So like any medication or other vaccines that have come out, there are always side effects,
Yes.
right?
Yes.
And so are there any safety concerns about the COVID-19 vaccine that I should be aware of? So when I take it, I'm not, when it's available, accessible to me and my family, there aren't any surprises. I'm aware of what concerns may arise if there are any.
Yes, with any vaccines, you can get some soreness at the site of the vaccine. For this vaccine in particular, you can get soreness at the site. You can get a fever. You can get a headache, or body aches. Those are proof that your immune system, your defense system, is working and reacting rightly to the vaccines. So those are what people take it should expect. We also want when people take the vaccine to sign up for the vSafe app that the CDC has put out, because it will help to track other symptoms that patients may experience after the vaccines.
Okay. So Dr. Duvilaire, we know that there has been a mass commitment to getting out a vaccine fairly quickly because the spread has had adverse impact globally. And I know that you talked about the vaccine going through the proper protocol, but I think there are still some concerns about anything that may have been missed. So I just want to hear from you. Have you heard of anything that was skipped during the review process before making the COVID-19 vaccination available to the public?
It's important that our people know that nearly 70,000 people were involved in terms of the testing of this vaccine, and those 70,000 people were of all races, ages, as well as sexes. So quite a broad spectrum of the population has had the opportunity to be involved in making this vaccine a reality. So I think as people of color, we should know that we also were included in the validation of this vaccine, and that yes, safety protocols were used, reviews were used, and are still being continued to be used, so that we can really have a vaccine that works.
Thank you so much, Doctor, for taking the time to speak with me today. The information that you provided was very helpful and most importantly reassuring. And I personally look forward to taking the vaccine once it's available to me. And I truly appreciate you debunking some of the concerns and notions that people may have had about vaccination. So thank you so much for your time.
Well, Councilwoman, it was my pleasure to be able to speak on the vaccine. I will continue to reiterate to our people the need to keep wearing our mask, to wash our hands, to keep the distance. Yes, we have the vaccine. Yes, there is work being done on other measures, but those are the important steps that we need to keep. And also I want to say that yes, great lengths have been used to keep this vaccine safe. So I look forward to the day when we will not have to wear a mask, when we will be able to meet with our family and friends again.
Yeah. And I just want to say thank you to you and all the healthcare providers, frontline workers, for taking care of us and ensuring that we're safe. And I think it's important for the community to remember that if we follow the protocols, we stay safe, we keep our household safe, the people who are providing care for us, they too stay safe. So thank you so much for being here and your advocacy.
Thank you very much.
Thank you.
Thank you.